Hello class, my name is Jocelyn Ellis and I've decided to do my project on substance abuse and misuse. Alcohol intoxication abuse. Even though alcohol is very present in our culture, it is still classified as a drug. Prolonged alcohol abuse, as with any other drug, can lead to illness, poisoning of the body, abnormal behavior, even death. As an emergency responder, try to provide care to patients suffering from alcohol intoxication as you would any other patient. If the patient allows you, conduct a secondary assessment that includes a thorough history. In some cases, you may have to rely on bystanders for meaningful information. For all situations involving patients with alcohol or other drug emergencies, perform a thorough scene size-up and remain alert for changes in mental status. Signs of alcohol intoxication. Odor of alcohol on the patient's breath or clothing, unsteady, uncoordinated movements, slurred speech, and the inability to carry on a conversation, flushed appearance, often sweating and complaining of being warm, nausea, and vomiting. Signs and symptoms of alcohol withdrawal. High blood pressure and rapid heart rate, confusion and restlessness, abnormal behavior, hallucinations, tremors, obvious shaking of the hands, and convulsions. Basic care for alcohol abuse. Take appropriate BSI precautions and perform a primary assessment. Ensure a clear airway and adequate breathing. Perform a thorough secondary assessment to detect signs of illness or injuries. Remember, alcohol may mask pain. Look carefully for mechanisms of injury and signs of illness. Monitor vital signs, staying alert for respiratory problems. Help patient when they are vomiting so their vomit will not be aspirated or inhaled. Drug abuse and overdose. Drugs may be classified as uppers, downers, narcotics, hallucinogens, and volatile chemicals. Uppers, stimulants affecting the nervous system to excite the user. Downers, depressants meant to affect the central nervous system to relax the user. Narcotics, affect the nervous system and change many of the abnormal activities of the body. Often they produce an intense state of relaxation and feelings of well-being. Hallucinogens, or mind-altering drugs, act on the nervous system to produce an intense state of excitement or distortion of the user's surroundings. Volatile chemicals, give an initial rush but then depress the central nervous system. Significant symptoms related to drug use. The signs and symptoms of drug abuse and drug overdose can vary patient to patient, even for the same drug. When questioning the patient and bystanders, you will get better results if you ask if the patient has been taking any medications rather than using the word drugs. Stimulants cause excitement, increased pulse and breathing rates, rapid speech, complaint of going without sleep for long periods of time. Depressants cause patients to be sluggish or sleepy, lack normal coordination of body movements, and slurred speech. Hallucinogens, fast pulse rate, dilated pupils, flushed face, often sees things and hears voices and sounds that are not there. Little concept of time, no sense of speaking, and paranoia. Narcotics, reduced pulse, breathing rates, lowered skin temperature, pupils are constricted, muscles are relaxed, heavy sweating, and overdoses. Coma is a common event. Volatile chemicals, may seem dazed, patient may go into a coma, nose and mouth may show swollen membranes, there may be a chemical odor to patient's breath, skin, or clothing. Basic care for overdose patients. Take BSI precautions and perform primary assessment. Maintain an open airway to ensure adequate breathing. Perform secondary assessment. Obtain baseline vitals. Administer oxygen as per local protocols. Be alert for vomiting and the need to manage the airway and breathing. Continue to reassure the patient throughout all phases of care. For all cases of possible overdose, this is a good practice to contact medical direction and your local poison control center. Also, be sure to locate any drug or pill containers and give them to the EMS crew when they arrive.